The TCD Project LLC featuring Online Training 2020 Santa Clarita, California. The mission of the TCD Project LLC is to plant the seeds of transcranial Doppler in every single student of diagnostic ultrasound in the USA and the world. Our sponsor, DWL, with the most precise and meaningful findings is Doppler sonography. We created this serial videos of TCD training with cooperation and endorsement of our TCD lifetime expert Alexander Razumovsky, sponsored by CBD College, Los Angeles, California, and his brilliant ultrasound program director Alex Gelfand, and the magnificent DWL team Monique Malatz and Dan Henry. This educational videos are dedicated to all the ultrasound students in the USA and the world. Components of the Circle of Willis: 2 ICAs, 2 A1 segments of ACA, anterior communicating artery, 2 posterior communicating arteries, 2 P1 segments of PCA, basilar artery complete in only 20% of individuals, fetal origin of PCA, hypoplastic posterior communicating, hypoplastic A1 segment of ACA. Transcranial Doppler studies focuses the Circle of Willis. Before we start interrogating every single artery using our equipment, we strongly recommend knowing your anatomy and some historical facts. Sir Thomas Willis, MD, died on November 11, 1675, field of study neurology, anatomy, and Richard Lauer was a British physician, student of Sir Thomas Willis, who named the cerebrovascular discovery after his teacher. We can appreciate the common carotid artery, bifurcation, and internal and external carotid arteries. Internal carotid arteries. Ophthalmic artery supplies the eye through central retinal and ciliary arteries. Posterior communicating artery, anterior carotid artery. Middle cerebral artery. Largest branch of the ICA, trifurcates into temporal, frontal, and parietal branches that supply most of the parenchyma of lobes. Supplies most of the lateral surface of the cerebral hemisphere and deep structure of frontal and parietal lobes. 3 segments, proximal or horizontal portion M1, Sylvian or insular segment M2, apicoloar or distal segment M3. Anterior cerebral artery. After its origin runs anteromedially to the interhemispheric fissure. Joins the opposite ACA via the A, closing the rostral portion of the Circle of Willis. ACA supplies the medial surface of the cerebrum and upper border of the frontal and parietal lobes. A1 segment proximal up to A. A2 segment begins after A, medial strirate or recurrent artery of Hubner. A3 segment callosal and hemispheric branches. Internal carotid artery. Ascends through the base of skull to give rise to the anterior and middle cerebral arteries and connect with the posterior half of Circle of Willis via posterior communicating artery. We have 2 classifications. First one proposed by Fisher in 1938, C1, C2, and the new classification for the TCD application we use is C1 segment. The ICA is divided into 8 segments: cervical, ascending petrous, horizontal petrous, ascending cavernous, horizontal cavernous, linoid, ophthalmic, and terminal. In the classification proposed by Las Winias and Santoyo Vasquez, segments 7 and 8 are grouped as a single terminal segment for a total of 7 segments. Ophthalmic artery, posterior circulation vessels. Vertebral arteries, for the TCD application we use the V4 segment, potentially V3. Anastomosis definition, occur normally in the body and the circulatory system, serving as backup routes for blood flow if one link is blocked or otherwise compromised. Circle of Willis, the most important, connects the ICA and the VB systems. Atypical Circle of Willis in 79% of cases. Other anastomoses, branches of the extracranial and intercranial arteries. Leptomeningeal anastomosis. Main purpose, provides sufficient collateral flow. Anatomic variance. Variant incidence percentage. Classic or normal development of the Circle of Willis, 18 to 20%. Hypoplasia is an underdevelopment or incomplete development of tissue or organ. Hypoplasia of A1, 9 to 40%. Hypoplasia of A, 13%. Hypoplasia of P, 22 to 53%. Hypoplasia of P1, 15 to 40%. Hypoplasia of the Circle of Willis. This video is endorsed by Dr. Alex Razumovsky, sponsored by